I'll record it just in case, if it's useful for someone else. Great. Sure. We'll start now. So the first step is Dr. Munira has sent a case to me via 3shape communicate. So which is then available. So what I'm going to now do is that I'm going to go to model sets over here, go to my inbox, and I'm going to check that, okay, see, this is the case that she has sent Dr. Inamda's Dental Studio. Okay. So I'm going to right click and I'm going to hit accept. So it's going to download the case. Once it's downloaded over here, it directly starts reflecting into my patients. So I just have to look for Ahmed Didi into my patients and it will be directly available and it will be as Dr. Munira sent it to me. At whatever stage she saved it last, that's how it will come to me. If it's taken with a 3shape scanner, so the same colors and everything will be visible to everyone, I mean to us, while working on it. Okay, so let's see, it's done over here. And how do I get everybody's videos on? Or am I sharing the screen? That's why I'm not able to see the video. Okay, forget it. Okay, so let's hit patients. And can you see that Ahmed Didi is right here? Okay, so I click on that and I hit clear aligners as of now. So Dr. Munira, you're left to still, prepare the models properly for 3D printing, or
I
are you
have
in a
done that.
stage of
I have just
evaluation?
I have just done the planning. One
Okay,
I have done. I've sent it to you, and then I put attachments, and again I sent it to you. So I've sent it to you 2 times.
okay. So let's check which one has come right now. So was this scanned with a 3shape scanner?
Yeah. 3shape scanner.
So then why is it that it's like this? Did you use an import function to import it, or did you send it via communicate from your scanner laptop to this laptop?
I have sent it to from ortho 3shape only. Not from
You sent it
scanner,
from
from the
Unite to this
software.
from the software directly, right? You have not imported it,
Yeah.
right?
No.
Then it's surprising that
This is the second time I have sent you that the second one is there. I have sent one more. This is with attachments.
yeah, this is with attachments, right? No. I'm talking about yourself because you also should be getting the real colors because you've scanned it with 3shape. Okay,
Yeah.
doesn't matter. Let's look at the case. Let's go to the pre. So you hit the default over here and you can evaluate that what is the patient's pre situation. Okay. So if we notice over here, we see a class 1 molar relationship, class 1 canine relationship, slightly tending maybe slightly towards class 3, and similarly over here. Okay. So okay. So what is the patient's chief complaint, Dr. Munira, over here?
Patient is basically come for that central incisor, which
Okay.
has to be extracted. It has got a lesion,
Okay.
periapical.
Okay.
So now we are going to implant, but to improve the smile, we have suggested the aligners. So he's from abroad, so we are planning aligners. Like otherwise, ortho would be ideal, but we are giving him aligners. So first he was going to do only lower, but upper also we are planning to do now.
Okay. Super. So what is our primary intention to correct in the lowers?
Closing the spaces and proclination.
And proclination. And what about the uppers? Similar?
Same thing.
Same thing?
Yeah.
So at what stage is this central going to get extracted, the 1 1?
It will be extracted now only, tomorrow.
Okay, it'll be extracted right now only, and then the treatment is going to start. So we're going to leave a dummy tooth throughout the treatment so that the patient has something to wear in the anterior segment. Perfect. All right. So let's jump directly. So let's consider that this is how you have thought that this is how you want to plan the case. All right. So this is how we are closing the space and everything. We'll go into the intricacies if we have the time. But as of now, our agenda is to learn staging. All right. So at this stage, once you have created the sub setups like this, you come to this last icon over here, which is setup and staging timeline. You hit that and you have all the teeth that has any movements going on, they all appear with a green line showing that it's going to take 19 aligners in total for the software to achieve this result. So now let's for an instance, let's come to the uppers, because I'm sure the lowers are the ones that are going to require the maximum amount of treatment. So the 19 aligners are actually for the lowers, but we understand that the upper is not undergoing that much amount of treatment. Okay, so let's see. As we can see over here, if I hit this tooth, you can try and see that it's undergoing about 6.5 millimeter of rotation and hardly 0.7 millimeters on an average of translation for this lateral incisor. For the central incisors, it's 2.2 degree of inclination, no rotation or derotation as we call it, and hardly 0.6 millimeters of translation. And the first quadrilateral incisor also just has 0.2 millimeters or 0.2 degree of inclination. So actual movement that is happening throughout the upper segment is very, very minimal. So it doesn't make sense that you increase the cost of your and your patient by making 19 sets of aligners. So we are going to now come back to staging, setup and staging timeline, and we are going to check. So let's pick 1, 2, for example, and hit waypoint. After waypoint, you come to the dot that is right above your first aligner. This shows that this is sub setup 1. Right above that, so it shows that it's undergoing inclination change of 0.1 degree. Juice हुआ था बच्चा. Prachi, 0.1 degree over here. All right. So if you can, so what is the normal allowed angulation? 1.5 degrees.
Yeah.
Correct. So you can imagine that you at least have 10 times the possibility. So let's check some other tooth. Let's check 1, 1. Even lesser than that. Let's check 2, 1. 0.1, approximately similar. And let's check this 0.03 and rotation of 0.3. Okay. So let's come to this timeline. Let's hold shift and hit 2, 2 to 1, 2. Okay. This selects all the upper teeth that are moving, and you drag with your mouse to get it to 5 aligners. Okay, just 5 aligners. And let's check now. Go to waypoint, inclination of 0.4 degree. Is it acceptable?
Yeah.
All right. So don't keep your this thing on mute. Keep it open so that we can have an interactive session. What is the inclination? Minus 0.2 degree. Acceptable or no?
Yeah.
Acceptable. Correct. 2, 1, 0.4 degree. Acceptable. 2, 2, rotation of 1.3 degrees. So 2, 2 is undergoing the maximum amount of movement. Okay. So it's undergoing a rotation of 1.3 degrees, which is ideal for us. So it's not that I have applied some formula over here. What I've done is I've randomly, taken it from 19 to 5, and I just went in and calculated that, okay, approximately are all my values within my, stipulated controlled values or no? If they are, that's fantastic. So for example, looking at my 1.5 millimeter limit, I can actually move it to 4 aligners also. Come to waypoint, hit 2 and check. Rotation 1.6 degrees. Can you see?
Yeah.
So by increasing or by reducing one aligner, I have slightly crossed my limit. So I would rather let it stay at about 5 aligners, which is quite acceptable, right? So you can eventually decide that you can start the patient using the 5 aligners at the end of the treatment, or you can ask the patient. So 19 aligners is approximately how many months? 19 aligners is 4 4s are for 5s is 20. So that's
Five
four
to
and a
six
half
months.
months.
5 months. Yeah.
Yeah, 4.5 months approximately. So you can ask the patient that, okay, you start with the upper, but the patient can continue wearing the upper aligner for a month, something like that. Because there is no point finishing the treatment entirely in the beginning. So you can either tell the patient that, okay, you can wear the aligners, you know, or you can start wearing the aligners at third month and wear it for 10 days or something like that. Is the concept clear? That's up to you. That's
Yeah.
the clinician's choice to decide whether you want to ask the patient based on the patient's comfort also. That if you find that the patient might be more comfortable just wearing one aligner right now, then just start with that. Let the patient finish about 12 aligners and then give the rest 5 aligners to the patient, which then the patient wears it for maybe 2 weeks, something like that. So from 11 to 19, the patient wears the last upper 5 aligners, and the first 10 aligners, the patient can just continue wearing the lower aligners. If the patient would have had a lot of treatment, that's happening in the lowers, like for example, some amount of posterior movement also happening in your aligners, then I would have strongly recommended that you give the upper and lower aligners together. But since the patient is, you're moving only canine to canine, so the posterior separation that is achieved by wearing the upper aligner also is not really going to benefit over here. All right. So
Okay.
is the concept of staging very clear? So few
Mayank,
points that, yes.
Mayank, how do we add sub setup? So in case there is a crowding case where
Mhm.
we want to open up the crowding first and then bring about retroclination. So how do we add sub setups?
So are we clear with this? So then if we are clear with this, then I will move on from this case, and I want to show a few things, and then we'll come to Dr. Karanjit's doubt also. So I'll open some
I have a
crowding case.
question. I
Yes.
have a question. After you have done that staging part, you have taken it to 5. Then how do you export it? And when the export thing comes, will it show that upper is showing 5 and lower is showing 19?
Yes, I'll show you. So before going further, no, I want to point out few things, Dr. Munira.
Yeah.
The attachments that you have put, no, for example, have a look at this attachment. It's in air over here.
Okay.
And I'll give you the bad news that since you created the sub setups after, okay, no, maybe we might get lucky. No, not allowing. So the bad news over here is you unfortunately created the sub setups after adding your attachments, right? Did you?
Yeah.
So the moment you do that, if you remember that once you have done that, the software does not let you edit your attachments. So you
Yeah.
have to be very, very careful. Everyone that's online right now, one thing that I would like to point out, something that I've learned, a hard way, is that when you're adding attachments, like for example, if I go right now and if I add an attachment over here, so if I add an attachment like this, so now it's editable. Like if I go to this tool, add an attachment over here and come back to this, it will let me edit it. And it will let me delete it also. Can you see? But the same thing with
Yeah.
Dr. Munira's added attachments does not happen.
Okay. That is fixed now.
That is fixed now. That's incorporated into your plan and it's now a part of every sub-setup. Okay. So what you should do is, before, unless and until you're 100% sure, do not make the sub-setups after you go here and you calculate, okay, how much is it coming up to? Don't break it down into a sub-setup unless you're confident that the attachments are in its right place. I can actually save the case at this stage, like by pressing this save icon over here. You can see generating model previews. You can see the cursor rotating, and I can close this and come back to it. So I can close this like this, and I can come back to clear aligners, and you will find that the attachment that I've added on my canine is still perfectly editable. But the attachments, so once you break it down into sub setups, it won't be editable. So right now, unfortunately, you will have to actually either start like copy and make a new case and then start adding attachments on top of it. So I'll show you all how, just a workaround, over this case.
Okay, Mayank, one thing, I was knowing this fact, what you have told just now, but the problem was I could not start the staging and timeline thing until I was doing the sub setup.
Yeah, that's correct. That's correct.
So that's why I had to do the sub setup to see the timeline thing, because you had told me in the morning.
Yes.
So I wanted to reduce the timeline. For that reason, I did the sub
Did
setup,
that.
because
But
that was
whenever you're adding the attachments, no, Dr. Munira, can you see this?
Yeah.
It's never going to bond. So your primary complaint in most of the cases would turn out to be that my posterior attachments don't stay. See this? It's only making contact over here. The molar is okay. But you got the point, right? What I'm trying to tell you, that the attachment that you add. So let me show you the next premolar over here. So the attachment that you add, this is how you added your attachment. For example, like this or like this. Then you try and use the green bar to increase its length, and then you shove it inside. And then increase the surface area or make it flat like this. Can you appreciate how intimately in contact it is with the tooth?
Yeah.
So please be careful with this thing, because these attachments won't last. So now by mistake, if you did this mistake, then what we can do is we can try.
Man, one more thing you had asked
Yes.
us to incline the attachments. तो वो कौन से undercuts किधर होना चाहिए एक बार खाली, can you show up again?
So let me enhance it a little bit so that you all can appreciate this. Focus on the yellow. So this will be inclined at an obtuse angle from the gingiva. I'll explain the logic also in 1 minute. ऐसे थोड़ा exaggerate कर दिया मैंने, but did you get the point? The obtuse angle will be towards the gingiva, or from the cervical part you make an obtuse angle and not a 90 degree. You keep it 90 degree if they are anchor attachments. But if they are about, or they are supposed to bring about some movement in teeth, then you compensate it like this. Clear? So that if there is any tracking loss at this point of time, the aligner will still make some contact with this flat surface. But on the contrary, if it is 90 degree and if there is a tracking loss over here, any tracking loss that happens over here, it will just not make a contact only, and it will completely start losing track. Is it clear?
Okay. So the flat 90 degrees is for the retention, and for the movement is the obtuse angle.
Yes.
But if there is, if you want to do extrusion also, it will be similar only, no?
For example, if you're moving the premolar like this, then you want to give some amount of compensatory angle over here, so that if there is any tracking loss while moving that, or the tooth's movement, then it will still make some contact with the attachment's flat surface or the active surface. Okay. Is this part clear?
Yeah.
All right, so let's come to this sub setup and see, I can copy this setup. I can name it either plan 2, hit OK. So now let's hope it lets us edit something. Saw that? Now in plan 2, if you notice, it has not subdivided the plan as yet. So now I can go here and I can change the attachment. So I'll just try and show you one or two of them. Can you appreciate the difference?
Yeah.
Huh, Dr. Munira?
Yes.
Yes. And one more thing that I would like to tell you is that whenever you're adding the attachments, you can try and use the beveled surface on top also. Sorry. You can sometimes do like this if it's just an anchor attachment. Clear?
Okay.
Okay, so now I want to show you, so I'll go back to your previous plan and I will show you how the staging shows. Can you appreciate that moment I opened staging, it shows that, okay, only 5 aligners for upper and the rest 19 are for lowers. So now when I go to export, have a look at this window. That when you see over here, from okay, because I made some changes, I still need to make it into a subset of count. Okay. So the one more thing to remember is if you subdivide the case into subsetups after you have done the staging, then the staging goes away. So
Yeah.
so now I'm going to select all the uppers again and I'm going to again get it back to 5. Once I'm done with this, I go to export and see, after subset of 5, the 6 does not show upper model. 7 does not, 8 does not. Can you appreciate?
Yeah.
12 does not show upper model. It's not going to export it only.
Okay.
Clear?
So you have to subdivide and then go to staging.
Yes.
मैं एक बार वो एक्सपोर्ट का ओपन करो ना विंडो.
हाँ. हाँ.
अभी इसमें एक्सपोर्ट मॉडल्स फॉर रिटेनर्स तो निकालना है ना.
नहीं नहीं रहने दो, क्या फर्क पड़ता है.
नहीं तो मतलब लास्ट में अगर हम सब नहीं नहीं वो खुला रखो नहीं पर.
हाँ.
एक्सपोर्ट
Okay.
वाला.
एक्सपोर्ट वाला.
तो एक्सपोर्ट मॉडल फॉर रिटेनर्स मतलब एक और मॉडल बिना अटैचमेंट्स के वो एक्सपोर्ट करेगा, राइट?
हाँ, बट दिस मॉडल नो, इफ एट ऑल बाय एनी चांस यू वांट टू गिव इट अ शॉट नो, वो अटैचमेंट निकाल के आपको फाइनल प्रोडक्ट
देगा, ठीक है. और हॉलोइंग एंड वैक्सअप अगर रखा तो वो मेरा भी क्या होता है कैट पॉइंट्स के बाद तो ऑटोमेटिकली वो हॉलोइंग केस में चला जाता है.
तो वो यूज करना ही है. इफ इट इज ऑटो सेगमेंटेड नो, देन यू हैव टू यूज इट.
हाँ.
क्योंकि उसने
अभी
पहले ही पॉइंट यूज किए थे.
ओके. हाँ तो अभी पहले मेरे को सब सेटअप का अच्छा दूसरा अभी जब भी प्रिपरेशन में जाते हैं हम
हाँ.
तो मेरे पास दो ऑप्शन आते हैं लाइक फॉर यू आल्सो यू विल गेट जस्ट गो टू एनी वन केस.
Yes.
So I should go for automatic one, right? Because
Yes,
I'm
yes,
using
yes.
CAD points.
No, वो
Okay.
ऑटोमेटिक वाला पार्ट एक्चुअली डज नॉट यूज दैट, आई मीन कैट पॉइंट्स आल्सो.
नहीं वो तो एक्सपोर्ट के टाइम पे होगा ना मतलब.
नहीं, ये प्रेपरेशन के पार्ट पे है ना, वो कैट पॉइंट्स नहीं यूज करता. So you
हाँ
can,
but I should use the automatic one only ना to save time.
yes, 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 you should use the automatic one.
And lastly my attachments अभी इसमें कैसे राउंडेड आपके आ रहे थे तो वो मेरे इसमें ऑप्शन नहीं देता है वो राउंडेड अटैचमेंट्स का.
हाँ, so what I'll do no, तो वो अटैचमेंट भेजता हूं मैं ग्रुप पे, वो वाला। तो उसको ऐड कैसे करोगे वो देख लो। So you go to settings, you go to clear aligners, you go to attachments. After going to attachments, you hit the add button over here, and then you add a additive model.
Okay.
अब ओके, इंपोर्ट करना कहाँ है? हाँ वो। So then now you browse to wherever you have located that, whether it's downloads or something. You select, double click. Only 10 minutes are remaining for the meeting. Okay. So वो Zoom का वो है, it's going to it only allows 40 minutes on a free Zoom account. So you browse to wherever the attachment that I am going to send you to that, and then you add it into this, and it automatically saves, and you save it as whatever you want to save it, like a new or whatever, rounded, whatever you want. I call it rectangular.
Okay. Okay.
So उस तरीके से you save it like that. All right, and then can you see this settings के ऊपर एक CD type का icon?
Mm-hmm.
You have to hit that save settings. You have to, otherwise it won't get imported. Got it?
Okay. Got it.
है ना? So now I'm just opening a crowding case for you to just show some kind of staging as a as an example, because the moment the meeting will stop, no, for 15 minutes it won't allow me to create one more meeting. But whatever, is the staging part clear? How you go about, calculating, and then how you maneuver by, increasing and decreasing the number of aligners, and then going back and recalculating.
Yeah.
All right, so let me create a copy of this setup. Let me call it demo and hit OK. You double click on demo, only then it comes to this version of it. Okay, so now let's see what kind of movements we are doing. Okay, we are doing drastic movements for this case, right? So let me subdivide this into small subsetups so that we can visualize a video. So I will go to this, I will perform collision detection, I will turn it on, I will turn off the pre. Okay, now only focus on the two central incisors. Okay, see the kind of intersection that it is going through. See, till 0.3 it is okay. Now it is crossing 0.6, 0.7 maybe. Can you appreciate?
Yeah.
It's not going to happen. See, at the end it's ending at 0.6, but it is crossing 0.7 at some point or the other. It's never going to work like that. Got it? So now suppose, let's try and see that how is it moving, or let me think that, okay, let me go to malocclusion, and I want to first get this central out and then turn this. So what would I do is, I go back to demo, and see, you have to come to your last step when you want to start staging. You cannot do it in malocclusion. It won't be highlighted. Highlighted, very good. So let me still go so that something does not work. Okay, so I want to stop my, or I want to start my 1-1 immediately as the aligner starts. Let's see, it's undergoing a rotation of 0.9 and I want to take it to 1.5. So I will go to timeline, and 1-1 I will make it half, so that's 17. So let me get it to 8 and go to waypoints and check again. So 1.9 degree rotation. So I want to add one more aligner over here. Let me take it to 9. 1.7 degrees, acceptable. Okay. So I'm going to finish my central incisors. So 1-1's entire treatment in 7 aligners, and I will start my 2-1 from the 7th aligner. And go back to waypoints and check. Oh, That's quite high because it's 2.9 degrees rotation. So I'm going to start this 2 or 3 aligners prior. So that's about 6th aligner. Go to waypoints and check 5 minutes remaining. Rotation of 2.1 degrees. Not acceptable. One more aligner and rotation of 1.9 degrees. Okay, but let's see. Let me recreate the video and see. Can you appreciate my 2-1 is not moving at all?
10 minutes.
0.4, 0.5, 0.6, 0.6. But did you understand, Dr. Karanjit, how this was staged?
Yeah.
See, at the
Yes.
end, in this case, because of my black triangle, I have purposely planned a 0.6 mm of IPR.
Mm-hmm.
To appreciate, and I am so sure I'm going to require even more IPR because her teeth are very triangular. And she's a very young, she's about 19, 20 years old, this girl, and she's never going to accept such a big black triangle over here. So I am mentally prepared that I want to achieve this much IPR by default. है ना?
Okay.
But then it should not cross this amount while doing the process. So what I would now try and do is that I will increase the number of aligners. It's doing this movement in 17 aligners, right? I can go to this and I can make it finish the treatment in 20 aligners. Again, my staging will go away. I will tell that, okay, my 1-1, you finish in 7 aligners, and your 2-1, I want it to now start from 7th aligner. Let's go back and visualize the video again. Okay, 1, 2, 3, 4, 5, 6. Saw that? So the combinations are endless that you can actually achieve. It's about your thought. Like, for example, if you think that, no, I want to translate it more first and then move, then rotate it. So then you can go into staging the kind of detailed changes that you can bring about. So that's translation. So you can say that, okay, the translation part, you start from here and you finish it in 2 or 3 aligners. And let's see. Okay. Did you see the values? 0.3 millimeter, 0.5 millimeters, which is nothing.
Mm-hmm.
So let's see now. So it's going to distally move first and then rotate. Oops. Didn't work in my favor. So basically it's not moving distally as much as it is moving towards this part of the tooth. So it doesn't work for me. So there is no point that I make it like this, and it should continue at the existing stage. But did you get an idea?
Yeah.
The staging timeline option allows you to stage each and every movement. You can actually and practically customize every movement, like the forward, backward. So if you want it to intrude first and then rotate first and then intrude, and stuff like that. It's crazy what you can do, and you can even make parts, sort of it. So that's how you can try and do that. Is this clear?
Yes.
But at least sufficient enough for you guys to start with something. So before we
Ma'am,
end, I have exactly 1 minute remaining. Any doubts?
quick question.
Yeah.
Tight contacts, let's say, how much is the collision value? Tight contacts is
0.14. I mean
and
0.15.
0.15. And उसमें जो small teeth constraints example है वो delete बंद रखना है ना
हाँ, वो बंद रखना है. इसको हमेशा बंद रखना है.
Okay,
You
okay,
keep
got
it deselected always.
Perfect. Done.
All right, chalo, great. It's going to end any moment. So I hope this was helpful. Good night, and we will soon meet. We'll meet next week for a good and a nice study club session. And if you have any topics that you want us to take up, you message on the group and keep. Any more doubts, you message on the group and keep. All right.
Okay, thank you
Attachments.
so much.
Send the
Thank you,
attachments,
Manish.
Priyanka.
Pardon me.
Yeah.
Send the attachments.
I'll send the attachments. Perfect. All right.
Okay.
Chalo.
Sure.
Thank you so
you.
much.
Good night.
Good
Bye-bye.
night, guys.
Thank
Bye.
you.
Bye.
Thank you.
Bye.